donation camps, adolescent health promotion, and mental health advocacy. Her exceptional contribution have been recognized with several prestigious honors, including the Best Nursing Teacher Award and the Co-Patrons Honor Award on International Women's Day 2025, celebrating her outstanding achievements in nursing education. Dr. Habib continues to inspire students and healthcare professionals through her vision, scholarship, and compassionate leadership. On behalf of the organizing committee of ERICA chapter, ma'am, I welcome you, and it's my privilege to extend a warm and heartfelt welcome to you, ma'am, and we are truly honored to have you. Ma'am, we would be truly honored if you could address the gathering and share your valuable experience and words of encouragement with all of us. Over to you, ma'am.
Am I audible, ma'am?
Yes.
Thank you, Dr. Anjana, ma'am, for your lovely introduction. First of all, a very warm and respectful good afternoon to everyone. I begin with a heart full of gratitude. I extend my deepest salutations to the organizations of this prestigious national webinar, ERICA chapter, NSS Uttarakhand, SIMS College Dehradun, and Arugam Nursing College Roorkee. I want to begin by saying a very special and heartfelt thank to our patron, ma'am, Dr. Sukhana, ma'am, who invited me and trusted me with this wonderful opportunity to be your guest of honor today on this momentous occasion of International Day Against Drug Abuse and Illicit Trafficking. Thank you, ma'am, for believing me. It's an honor to be here because of you. Also, my sincere thanks goes to the Dr. Binu Joy sir, chapter president, Professor Navneeta Krish, vice president, Dr. Anjina Williams, secretary, Mrs. Chitana, and Dr. Raman Kalia ma'am, Dr. Mohammed Hussain, and Dr. Bhaskara, and other executive team members of ERICA Chapter 13. Today, the 26th of June, the world unites in observance of the International Day Against Drug Abuse and Illicit Trafficking. It's a day of global mourning for lives that lost and a day of global resolve to protect the ones we can still save. Drug abuse is not merely a legal issue, it's a public health crisis that destroys families and devastates communities. As we gather here digitally today, thousands of young people across India, from urban cities to the remote villages, are silently battling the addiction. As an academic leader, I have witnessed firsthand how geographical isolation, unemployment, and lack of mental health awareness can act as a fuel for substance abuse. In these regions, our nurses are often the only healthcare professionals whom the people trust and who have access to the nurses. And here is where the blessing of this profession comes in. As nurses, you are the ones who hold the patient's hand when the doctors leave the room. You are the ones who hear the stories that don't make it into the medical charts. My blessings to you today is this: let your stethoscope listen not just to the lungs and heart, but to the silent cries for help. Today, I humbly pray for the five universal blessings upon this gathering. First, the blessing of intention. May every question asked, every slide presented, and every discussion held today be rooted in the purest intention, not merely for certificates, but for the betterment of human life. Second, in the fields of nursing and healthcare, we deal with the most fragile gift of God, that's human life. Today, I pray that you do not just acquire the information, but that you gain the wisdom. Third, the world today needs the warriors in white coats and nurses with compassionate hands. I bless you with the strength to stand tall when the shifts are long, when emotions run high, and when burdens feel heavy. Fourth, the blessing of the unity. This webinar is a collaboration across Uttarakhand, Dehradun, and Roorkee. It's a proof that when we come together, we grow together. I pray that the connections you make today blossom into the lifelong collaborations. In a country as diverse as ours, let us always remember our different paths may be many, but our destination is one, that's humanity. Then, at the end, the ultimate blessing of the success. May the insights shared here today enlighten your minds, empower your practice, and bring healing to your communities. May you be the light that dispels the darkness of addiction. May God bless you all, and may your journey in nursing always be guided by empathy, courage, and grace. Thank you, and I wish this webinar enormous success. Thank you. What to you, ma'am?
Thank you so much, ma'am, for your encouragement.
Thank you.
Moving forward, we have another guest of honor, and it's my great honor and privilege to introduce her. She's Dr. Mary John. She is currently serving as a professor and deputy director at Christian Medical College, CMC Vellore. She is an accomplished administrator and international trainer with an exceptional career spanning clinical practice, nursing education, and quality assurance and leadership. She has served in diverse roles, including clinical nurse specialist in pediatric intensive care, United States, assistant director of nursing in the Saudi Arabia Defense Health Services, and deputy nursing superintendent at CMC Vellore. Currently, she oversees hospitality and international relations as deputy director at CMC Vellore. Dr. Johnson has led numerous national and international initiatives as a master trainer for projects like GFATM, IMNCI, Infection Prevention and Control, OSCE, Child Protection, Diabetic Educator Programs, and Joanna Briggs Institute Systemic Review Program. Ma'am has published and presented research papers in national and international journals and conferences, authored 3 books, contributed 5 book chapters, and serves on editorial board for more than 100 international journals. She is also the editor-in-chief of multiple indexed nursing journals and mentored undergraduate, postgraduate, and doctoral research scholars. Her outstanding contribution have earned her numerous prestigious recognitions, which includes Life Achievement Award, Best Faculty Award, Best Administrative Officer Award, Global Excellence Award, Asia Pacific Nurse Specialist Award, Leadership Excellence Award, Best Academician Award, Best Researcher Award, and several international fellowship and honors. Ma'am has remarkable commitment to excellence in nursing field, and global collaboration continues to inspire nursing profession across the world. I would like everyone to please extend a warm and heartfelt welcome to our distinguished guest of honor, Dr. Mary A. John. Ma'am, we would be deeply honored if you could address the gathering and bless us with your valuable insights, inspiring thoughts, and word of encouragement. Over to you, ma'am.
Excuse me, ma'am. Mary, ma'am, are you available? Are you? Are we audible to you, ma'am? I think so. Right now, ma'am is not available.
Go to the next, and if she comes and join us, we can have her later.
I thank Anjana ma'am for handling the session. Thank you so much, ma'am, for introducing our guest of honor and chief guest. Thank you so much, ma'am, for your welcome address.
Thank you so much.
Moving towards the next, secondly, I would like to introduce the Erica chapter secretary, Mrs. Chetna ma'am. She is the principal of CIMS college, the one of the college which is contributing with us for this national webinar. Ma'am is also an organizer. She is also working as a principal in CIMS college. Ma'am is specialized in mental health nursing. Ma'am is having total 15 plus of years of experience in teaching profession. Ma'am has various research and she has also been an author for various publications. Ma'am is also a very good leadership quality she is having, and she is also a excellent principal in CMI's college. Ma'am, I want to welcome you to address the special guest of today's webinar. I welcome you, ma'am, and ma'am has also been a moderator for today's webinar for the first session. Welcome you, ma'am. Chetna ma'am, I am audible to you, ma'am?
Yes, you are audible. Am I audible?
Yes, ma'am. Thank you. Yes, ma'am, you are audible for us. Thank you so much, ma'am.
Thank you, Sheetal, for such a lovely introduction. Good afternoon, everyone, and I'm here to extend a warm welcome to our special guest of the event, Dr. Mohammed Hussain. Professor combines vice principal with 18 years of experience in teaching and supervising nursing students, extensive experience in coordinating and supervising nursing courses like GNM, basic BSc nursing and MSc nursing courses. Sir has also worked as a BOS chairman, academic council member at Maharashtra University of Health Sciences, Nasik. Sir is currently working as a member of Board of Examination at Maharashtra University of Health Sciences, Nasik. Sir is experienced in training and mentoring nursing students with a strong focus on providing quality nursing education, PhD nursing, MSc nursing, medical surgical nursing. Sir, it would be an honor for all of us if you could address the gathering. Over to you, sir.
Thank you so much, madam. I'm audible to everyone.
Yes, sir.
Thank you so much, madam, for a beautiful introduction of mine. And first of all, I wanted to thanks to our patron, madam, Dr. Shu, madam. She is very enthusiastic and arranging lot of activities for all the nursing aspirants. So always we are going forward to see the madam and arranging so many things with the nursing personals. So now also I would like to thank to Binu sir, our national president of NSS. And also I am thankful to all the principal of two colleges, CIMS and Gokulam College of Nursing. And today's chief guest, Raman Kalia madam, today's guest of honor and special invitees. And first of all, I wanted to congratulate and thanks to all two colleges for arranging a beautiful topic with a beautiful day, that is a day of international against drug abuse and illicit trafficking. So once again, I want to congratulate and say great of words towards the beautiful topics, and always we have to give a special attention to these problems. Now it is emerging and it is a need of era. So once again, thank you so much for giving me opportunity to speak few words about this. And definitely we have to go with the problems which is existing, and there should be a good phase to remove all the problems like which we are facing. And once again, thank you to the MC Seetal madam. And thank you once again. Over to you, madam.
Thank you, sir, for such a wonderful address. Thank you so much. The next special guest of today's event is, I would like to extend a warm welcome to Dr. Bhaskaran. Dr. Bhaskaran is a dedicated nursing educator and researcher with expertise in psychiatric nursing, nursing research, statistics, and evidence-based practice. He is committed to advancing mental health care through innovative teaching, research, and interdisciplinary collaboration. Sir has earned his PhD from MGR Medical University in 2021, earned his postdoctoral from Lincoln University College, Malaysia in 2025. Sir has developed various online courses and has various research publications. Sir is also an editorial board member in more than 5 international and national journals. Sir has guided various MSc and BSc nursing students. Sir, we would be honored to have you here for your address, and we would love to hear a few words from you. Over to you, sir.
Good evening, ma'am. Can you hear me?
Yes, sir, you are audible.
Yes, sir.
Thank you, ma'am. Thank you for your nice introduction. Good evening to everyone. I am honored to be here today as your special guest on this important occasion, the International Day Against Drug Abuse and Illicit Trafficking. I thank the patron for inviting me and their entire organizing team for making this national webinar as possible. I extend my sincere respect to our seed founder and patron, Professor Dr. Suez Hana ma'am. Her vision and dedication have built a strong foundation for this organization. I also respectfully acknowledge our NSS National President, Dr. Binijo, for his continued guidance and leadership. My greeting to our chapter president, Professor Naveed Christ, for her efforts in bringing together Erica Chapter 13. Uttarakhand, CMS College, Dehradun, and Arogyam Nursing College, Roorkee for his collaborative event. I welcome all the speakers, participants, and attendees. It is good to see so many of you joining from different parts of our country. Your presence shows your commitment to this very serious and urgent cause. Today, June 26, 2026 is observed worldwide as the International Day Against Drug Abuse and Illicit Trafficking. This day reminds us of the grave danger that drug abuse and illicit drug trade pose to individuals, families, communities, and nations. I have been given a few minutes to share my thoughts. I would like to offer 3 important messages. First, let us spread awareness. Drug abuse destroys lives. It breaks families and harms society. Many young people fall into this trap due to lack of awareness or peer pressure. It is collective responsibility to educate ourselves and others about the danger of substance abuse. Knowledge is our first line of defense. Second, let us support prevention and rehabilitation. Prevention is better than cure. We must create safe environments in schools, colleges, workshops, and communities where people can seek help without fear or shame. And those who are already affected need our compassion and support, not judgment. Rehabilitation and recovery are possible with the right guidance and pace. Third, let us stand together against illicit trafficking. The illegal drug trade fuels crime, violence, and corruption. It exploits the vulnerable and weakens the social fabric. As responsible citizens, we must support law enforcement and policy measures that aim to curb this means. Our collective voice and action can make a difference. Today's webinar is a meaningful step in the direction. I appreciate the efforts of organizers for choosing this relevant and urgent theme. I once again thank Professor Suez Hana ma'am and Binijo sir and Professor Navita Chris for their leadership. I also thank every member of the organizing team for their hard work. I wish this webinar great success. May the discussions be meaningful and may they inspire all of us to work towards a drug-free society. Thank you.
Thank you very much, sir, for your inspirational words.
Thank you.
Now, it is my honor and privilege to welcome our very first resource person of today's event.
Chetan, can I interrupt? Mary is on login. She's in the meeting. Just
Okay,
give her
okay.
1 second to show her
Yes,
face,
sure,
please.
ma'am, sure.
Thank you. Mary, just show your face. She's in the meeting.
We welcome you, Mary ma'am. Already the introduction of Mary ma'am has been done. I request ma'am to share few words among all the participants. Welcome you, ma'am.
She just sent me the message. She's on. Anyway, sorry. Continue. Leave her.
Chetna ma'am, it's up to you. Over to you, ma'am.
So it is my honor and privilege to welcome our very first resource person of today's webinar, Dr. Alka Saxena, Principal, Government College of Nursing, Gorakhpur, Uttar Pradesh. Dr. Alka Saxena brings a wealth of experience and expertise to the stage, with over 33 years of professional experience, including 26 years after completing her postgraduate studies and 7 years after obtaining her PhD. She has dedicated her career to the fields of nursing, nursing education, and healthcare administration. She has served as a professor and principal at several prestigious institutions, including Government College of Nursing, BRD Medical College, Gorakhpur, Uttar Pradesh, and Sophia Nursing College, Gwalior, Madhya Pradesh. Her extensive administrative experience since 2005 reflects her exceptional leadership abilities. Dr. Saxena holds a master's degree in medical surgical nursing from the University of Delhi and a PhD in nursing specializing in diabetic foot care from MVGU University, Jaipur. Throughout her career, she has demonstrated excellence in administration, student supervision, faculty development, staff welfare, and contributions to nursing education and research. She has actively participated in numerous workshops, seminars, conferences, webinars, and professional development programs, serving as a speaker, moderator, and resource person, thereby contributing to knowledge dissemination and professional growth. Dr. Alka Saxena's dedication to nursing and her remarkable journey in academia, administration, and research makes her a truly inspiring and valuable speaker. We are honored to have her share her expertise with us today. She has published numerous papers in national journals. She has also served as a moderator for numerous webinars and academic programs. Ma'am is a recipient of the Best Teacher Award from NTAI, Uttar Pradesh. Ma'am is going to speak on the topic, the new face of addiction, vaping, e-cigarettes, prescription drug misuse, social media influence, and emerging trends among youth. Over to you, ma'am.
Good afternoon. Good afternoon to all of you. And I am very feel honored to have Professor Dr. Suresh Nerula Khanna ma'am. And it is my honor to have having you with us and sharing a platform with you all. Various dignitaries are there. And Dr. Binu John, Madam Raman Kalia ma'am, as a chief guest of honor, and special guest, and Madam Christina, that giving me this opportunity and for as a speaker. And I am truly thankful for your kind invitation, trust, and the opportunity to share my thoughts with such a distinguished gathering of nursing professionals. It is pleasure and privilege to be a part of this academic event. Thank you so much, ma'am. Now, just I want to say, can I share myself? You are sharing. Okay. So today, the learning objective, the topic which is given to me, that vaping and the new phase of addiction. Vaping and e-cigarette, prescription, drug abuse, social media influence, an emerging trend among youth. So this is really very important topic now. New generation, which they are consuming all these chemicals, and it is harmful for them. So at the end of the session, participants will be able to explain social media influence on youth for consuming all these items, these drugs and vaping, describe vaping and prescription drug misuse, discuss the Indian scenario and current statistics, and explain legal aspect in India, describe nursing responsibility and preventive strategies. Next. Hello. Next. Can I hear myself, ma'am? Hello.
Yes, ma'am. Your voice is cracking, ma'am.
Can I share? Okay, ma'am. Can I share from myself? Can I share?
Ma'am, it is already shared, ma'am. It is in the screen.
Wait, that is it's really. Can I share it? Because due to voice cracking, it is not changing. So now just you share. I will do this. Manage this. So digital technology has my voice is clear.
Yes,
Yes, yes.
My voice is okay. Because due to weather, there is some difference in internet. So that's why I have to please remind me if there is a problem in not able to listen. So digital technology has transformed from
ਮੈਟਰੋ ਚੇਂਜ ਕਰਕੇ ਸ਼ਾਇਦ ਜਾਏਗੀ ਮਾੜਾ ਜਿਹਾ ਅਮਨ ਨੂੰ ਫੋਨ ਕਰਕੇ ਪੁੱਛ ਲਓ ਜੇ ਕਸ਼ਮੀਰੀ ਗੇਟ ਮੈਟਰੋ ਸਟੇਸ਼ਨ ਤੋਂ ਉਧਰ ਆਉਂਦੀ ਹੈ
voice is coming. Can you say please?
ਮੈਟਰੋ ਹਾਂ ਤਾਂ ਫਿਰ ਥੋੜਾ ਜਿਹਾ ਟਾਈਮ ਸੇਵ ਹੋ ਸਕਦਾ
Please switch off the unmute yourself because this is annoying. Okay, digital technology has transformed youth behavior worldwide. New faces of addiction include social media addiction, vaping, prescription drug misuse, and online risky
ਪਰ
behaviors.
ਉਸੇ ਹੋਏਗਾ ਗੁੜਗਾਉਂ ਦੇ
So
ਕੋਲ
these problems are Chetna ma'am, please see that mute to madam. Okay. So you can see that social media addiction, vaping, e-cigarette, prescription drug misuse, online risky behaviors, and these problems are interconnected and significantly impact the physical, mental, and social health of the youth. Next. So why the now youth is vulnerable? There are service factors are there like peer pressure, curiosity, academic stress, and easy internet access. Previously, it was not there. Now the children is easily get the internet and they can see each and everything. And students are having the peer pressure. We visit and so many surveys has been done. Researches has been done. It has observed that the students have due to peer pressure they are consuming all and curiosity. And next, please. Other risk factors are social isolation, fear of missing out, mental health issues, and influencer culture. Now the influencer just do all these things, so students and new youth just think that it is very helpful, it is very good, and they also want to do this activity. Next, please. What are the social media which we generally see, and it is popular and we can get easily. The students and the new youth can get easily accessibility of all of these like Instagram, YouTube, Snapchat, Facebook, WhatsApp, Twitters, and the youth spend several hours daily on the digital platform. Next, please. The positive effect. Here you can see. Cut the effect. This one. Using for the education purpose, awareness, like health education, knowledge sharing, communication, professional networking, harmful. effects, harmful trends which is going on. Next. Negative effect. Next. Addiction, side depression, sleep disturbance. Please change the slide. Please change the slide. Okay. So what is vaping? Vaping, what you can say, vaping is the act of inhaling and exhaling an aerosol mist, that is dhua, mist by the electronic cigarette or other vaping devices. The aerosol is created by heating a liquid that may contain liquid flavored flavoring agents and other chemicals. It is not harmless water. It is not harmless water only. E-cigarettes were initially marketed as safer alternative to conventional cigarettes, but evidence shows that they can still cause significant health risks, especially among adolescents and young adults. Because when it was marketed in the e-cigarettes, it was shown that it is less harmful than the cigarette, which we know that additional people are using as a smoking. So it is equal or more than dangerous with that smoking. Next, please. So what are the components of e-cigarette? Like typically consist battery, heating element and coil, cartridge or pod containing e-liquid, or white mouthpiece and sensor or activation button. At last, can you please show the video?
Ma'am, we'll try to do it, ma'am, to show that.
Okay, at last. Okay,
Yeah,
at last. Next slide, please.
definitely.
Next slide.
Definitely.
Okay. So these are the components because it's having the battery. And I at the last I will show you this video. In that this part is shown exactly what it has. Then what are the health risks of vaping? Vaping is just a procedure like by the e-cigarette, because some chemicals are there and the person is smoking. So when it goes into the lungs, that it creates the nicotine addiction and dependence, increased heart rate and blood pressures, tough throat irritation and shortness of breath. Yes. Lung inflammation and respiratory. Please reduce immunity, sleep disturbance and headaches, effect on adolescents and young adults, impaired brain development, reduce attention and concentration, increased risk of anxiety and mood disorders, and greater likelihood of progressing to conventional tobacco use. So these are the side effects. And social media and vaping. What is the relation between two? Like social media promotes vaping through influencers, attractive flavors, viral videos, peer pressure, and this is the myth that vaping is harmless. Reality is that vaping is addictive and harmful due to nicotine. Next slide, please. Then there is some regulation in India. You can say that India has high burden of tobacco-related diseases. To prevent nicotine addiction among youth, the government of India has taken a strict stance against e-cigarette. Like although traditional tobacco products remain regulated under the separate law, electronic cigarettes are completely prohibited in India. It is banned totally. Young people are particularly vulnerable due to social media influence, peer pressure, and attractive flavors marketed by illegal sellers. So vaping in India, what is the last phase about the e-cigarette and e-liquids? Next slide, please. The Prohibition of Electronic Cigarette Act 2019. This act prohibits the production, manufacture, import, export, transport, sale, distribution, storage, and advertisement of electronic cigarettes. It is totally banned. You can Ravi Kishan, he is the Minister Sansal. You can see in the video how he's totally spoke about this, how this is to be bad. So what are the penalties for if anyone is breaching the law? First offense is up to 1 year imprisonment, fine up to 1 lakh, or both. And subsequent offenses, another the people is not listening about this, and then they are doing selling, manufacturing. So up to 3 years imprisonment, fine up to 5 lakhs, or both. So this is in India, it is totally banned now. Next. And this is the penalty super. And now can we see what are the nurses' responsibility regarding vaping? So health education, educate the patient, student, and families about the dangers of vaping. Correct misconception that vaping is harmless, and screening and early identification. Ask adolescent and young adult about vaping habits during assessment. Identify sign and nicotine dependence. Counseling. Provide cessation counseling.
Ma'am is
Motivate
having
individual to quit
sharing the
nicotine
link.
use and
If I will
teach
go back
coping
now, my
strategies
screen
to
is
avoid
already
relapse.
entirely uh, means
Then
like
community
it's
awareness.
going on shared, so it will be visible here.
Please unmute. Then health education to be given. Educate patients, students, and families about the dangers of vaping. Correct misconception that vaping is harmless. Screening and early detection and counseling. Counseling provides cessation counseling, motivate the individual to quit the nicotine use, and teach coping strategies to avoid relapse. Next. Next slide, please. Community awareness. Conduct awareness program in schools, college, and communities. Participate in anti-tobacco campaign and World No Tobacco Day activities. Advocacy and policy support. Support the implementation of anti-tobacco laws. Promote tobacco-free campus and workplaces. And refer services. Refer individuals to tobacco cessation center for specialized support. Next slide, please. Prescription of drug misuse. That is another subtopic which is given to me. That is the prescription drug misuse. Now the drugs which is prescribed for someone for getting relief, but another person is using it as. So this is the definition that prescription drug misuse is the use of prescribed medicine in a way not intended by the healthcare professional. So it includes taking medicine without a doctor prescription and taking the higher doses that prescribed, taking medicines for longer period than they advise, and using someone else's prescription medicines, taking medicine to get high, improve performance, sleep better or reduce stress, and prescription drug misuse in growing public health concern worldwide, and it is increasingly recognized in India. Next slide, please. Social media and prescription drug misuse. What is the relationship between these two? Social media and prescription drug misuse. These are the contributing factors like self-diagnosis, online trends, misinformation, and unverified advice. Next. So the people are using by own. So commonly, these are the drugs which is misused. Number one is opioid, that is used for the painkiller. It is used as a painkiller. Lead to moderate to severe pain. The examples are tramadol, morphine, codeine, and fentanyl. That is, the risk is addiction. If the person is overdosing it or using misusing this, so and there is a chances of addiction, respiratory depression, drowsiness, overdose, and death. So it should not be used. This is the misuse of that. Then benzodiazepines, it is used as a sedative, used for anxiety and insomnia. The examples are alprazolam, clonazepam, diazepam, lorazepam. The risk, which is that if it is misused, that memory impairment, dependence, confusion, pause, and withdrawal symptoms. Next slide. Another this drug which is used for attention disorder, stimulant like methylphenidate, risk is increased blood pressure, anxiety, insomnia, and palpitation. Next. Codeine containing. Another one. Next slide, please. Codeine containing cough syrups are there that is commonly misused due to easy availability or an euphoric effect. Risk, addiction, respiratory depression, and sedation. So these drugs, which is easily previously it was easily available, and person are abusing these drugs, cough syrups, right? Then risk factors are self-medication culture, easy availability of the medicines, peer pressure, academic stress, chronic pain conditions, mental health disorder, lack of awareness, and internet and illegal online medicine sale. Next slide. These are the risk factors. Then effects. When any youth is using all these, misusing all these drugs, then physical it create addiction, sleep disturbances, and cardiovascular problems. In mental, anxiety, depression, and poor concentration, isolation, family conflicts, and academic poor performance. So these are the symptoms. When you observe this type of activity, you can consult a person, youth, and you have to observe and as a nurse, what you can do. I have already told that you can approach all these things. Next. Then statistics according to National Survey on Extent and Pattern of Substance Use in India, 1.18 crore Indians use sedatives non-medically. 2.06% of Indians use opioids. Approximately 60 lakh people need opioid treatment. Around 8.5 lakh people inject drugs. So these are some statistics which I have taken because I was thinking another speaker has to speak on details. So just I have taken a little bit these statistics. Next. These are the Indian scenario. You can see the challenges. Indian population 144 crore, 20% of is 0 to 14 age, unpopulated UN population report. And these are the challenges, huge youth population, increased smartphone use, and easy exposure to online and misinformation and academic pressure. So all these you can see the previous generation and the new generation are they are just engulfed with all these things. Next. The Drug and Cosmetic Act 1940, regulates the manufacturing, distribution, sale of medicine. Certain medicine require a valid prescription. Important schedules are there. H schedule, prescription only medicine. Schedule H1, medicine requiring strict record maintenance. Schedule X, highly regulated medicine with stricter controls. These are the laws if present is there. Next. 1948, only registered pharmacists should dispense the medicines. Mental Health Care Act 2017, support treatment, rehabilitation, and protection of right of people with mental health and substance use disorders. That is there. Pharmacy Council of India, State Pharmacy Council. So this is there. Next. Some acts are there that control the misuse of drugs, but sometimes the youth get the medicine on another way. You can see in the society, the people are just rackets are there. Our youth is involved in that and having the many problems. Narcotic Drugs and Psychotropic Substance Act 1985, control production, possession, sale, purchase, and transport, use of narcotic and psychotic substance. It control all these things, and violation can result in imprisonment and fines depending on the offense. Next. Again, the nurse's responsibility is health education, educate youth and families, screening, identify risk factors, the behaviors, counseling, promote healthy choices, monitoring, observe the warning signs, refer off specialists. I think there is no need to explain because all the senior members are there. So these nurses' responsibility that can be carried out. Extra. Community-based nursing intervention also, that school awareness program to be carried out, parents education, digital literacy sessions, tobacco-free campus initiative, because all these things due to the ignorance and unawareness. So as a nurse, we can involve the teachers and other persons so that they can explain the parents also what are the signs and symptoms when the person is consuming these all these vaping or e-cigarette or substance abuse. Misuse all these drugs, prescribed drugs. So they have to see how they can control in the how they have to check the mobiles what they are all seeing. So all these things can be done, and there is a need to check by the parents and the teachers. And we have as a nurses, we have to aware all these things to the parents, teacher, so they can create a tobacco-free campus. And in home also, the parents can check what are the medicine is available and how the codeine syrups, so that it should not be excess in the room and should not be used. Next. Then other prevention strategies are the individual level, healthy habits, physical activities, stress management, family levels, open communication, school level, mental health programs. So these are like today we are having this webinar. So the main purpose of this that we have prevent all these illegal type of behavior, and how can we change due to the giving health education on that, so it can be checked. And the people must know about this. What are the legal penalties are there, and how can we control? Next. Then what is the role of education institution? Develop social media policies and conduct regular awareness program. Establish counseling services. Next, please. These are the institutional roles. And recommendation is there that strengthen with the increase anti-vaping campaign and relate the misinformation. Next, please. Next, please. Next slide, please. Then in conclusion, social media is a powerful tool that can positively educate or negatively influence youth. Early intervention, awareness, previous slide, please. Early intervention, awareness, supportive families, and proactive nursing care are essential to protect the young people from emerging addictions. Vaping is not a safe alternative to smoking because it was a myth. It poses significant health risks, especially to the young people. Nurses play a crucial role in prevention, early identification, counseling, education, and advocacy to reduce nicotine addiction and protect the public health. Prescription drug misuse is an emerging public health
Ma'am, you are not audible. Alka, ma'am. Alka, ma'am.
सुनाई
You are
दी
not. Yes,
Hello?
yes, yes. Now you are audible, ma'am.
Okay.
Thank you.
Okay. Sorry. So, vaping is not safe alternative to smoking. It poses significant health risks, especially to the young people. Nurses play a crucial role in prevention, early identification, counseling, and education and advocacy to reduce nicotine addiction and protect public health. Prescription drug misuse in an emerging public health issue in India. Nurses are frontline professionals who play a critical role in prevention, early detection, and patient education, counseling in state and medication, management. So all these things can be done so that we can prevent our youth for all these things. Because social media influence on in our youth is now we can see that because of less age, they are not understanding what is good for them, what is not. So they are just looking and due to the influence and look, they want to look chill, cool. So that's why they are just using all these things and they don't know what is the side effects in future, what they will happen. Like e-cigarette related popcorn lungs is there. Their mental ability, their physical abilities, all these things will go down and they will not able to perform properly in their life. So key takeaway, next slide please. Takeaway message. Key message is there. Next slide please. Okay, takeaway message is smoke-free does not mean risk-free. So vaping, it can harm health and lead to lifelong nicotine addiction. Prescription medicine are safe only when used correctly under the medical supervision and for the intended purpose. So think, and when you are using the social media, any form of social platform, so think before you click and verify before you believe. So it is the thing that that I want to say, that each and every person's responsibility to just save our youth by checking them, by just telling them, giving some health education in at home or school, or nurses get the opportunity to do all these things in society, in community. So this is my topic. If anyone have doubt, please can ask. Thank you so much, ma'am. Thank you everyone for giving me this opportunity. And you can show some, Sheetal ma'am, can you show the videos? 1 or 2 video I have sent you. That is the YouTube video that I have given. If it is possible, you can do
Ma'am,
it.
yes, ma'am, we are trying to do it.
So that little bit things will be clear. Because it is very harmful and it affects our youth health. Yeah. And just I want to say, previously when I got the topic, I don't know what is the vaping. So when I got the topic, because in our time it is not vaping, we just know about the smoking. What is vaping? I don't know. When I have searched and I see that this is the vaping. Vaping is the procedure using the e-cigarette, and there is some medicine. So just see this video. It gives some idea about that. Not drug abuse, the previous one. अच्छा ये प्ले कर दीजिए अभी हो पहला वाला वेटिंग का भी कर दीजिएगा इसका आवाज नहीं आ रहा कोई इसका वॉइस नहीं आ रहा प्लीज चेक
Smuggling, terrorism, money laundering.
Ma'am, it is voice is audible right now.
Or human trafficking, basic crimes or fund.
Now it is coming. So बड़ा करना
हाल ही में इंटरनेशनल डे अगेंस्ट ड्रग अब्यूज एंड इलिसिट ट्रैफिकिंग 2025 ऑब्जर्व किया गया। यूएन ऑफिस ऑन ड्रग्स एंड क्राइम के हिसाब से 2022 में
आजकल के बच्चे वेप और ई सिगरेट बहुत ज़्यादा यूज़ कर रहे हैं ये सोच के कि वो स्मोकिंग इतना हानिकारक नहीं है, बट मैं आपको ये बता दूं कि ई सिगरेट
मैम नाउ इट इज ऑडिबल
यस
और वेपिंग स्मोकिंग जितना ही हानिकारक है। ये इस सदी का सबसे खराब आविष्कार है। आजकल 14-15 साल के बच्चे हाथ में वेप और ई सिगरेट लेके घूम रहे हैं और वो ये सोच के ई सिगरेट यूज़ कर रहे हैं कि वो बहुत कूल लग रहे हैं। वेपिंग प्रोडक्ट नेचुरली ऑपरेटेड होते हैं, वो एक तरीके का लिक्विड को हीट करते हैं जिसको ई लिक्विड कहा जाता है और इससे एरोजोल बनता है जो आप लोग फेफड़े में इनहेल करते हो। इस धुएं में निकोटिन होता है और आप सबको मालूम है कि इससे आपका ब्लड प्रेशर और धड़कनें बढ़ सकती है और इसमें प्रोपिलीन ग्लाइकोल जैसे दूसरे भी केमिकल कैंसर होते हैं जो दर्द होते हैं फॉर्मालिटीहाइड में कन्वर्ट होते हैं और वो सबसे ज़्यादा शक्तिशाली कार्सिनोजन। तो अगर आप वीपिंग और स्मोकिंग दोनों में से भी एक भी यूज़ कर रहे हो तो दोनों को बंद करें और आपके फेफड़ों को बचाएं। आजकल के बच्चे
Okay, this is the short video which I took. Thank you so much. Thank you so much, everyone, for giving me this opportunity to speak on that topic. Thank you so much.
Wonderful, wonderful.
Thank you, ma'am.
Very informative.
Thank you, Alka ma'am.
Thank you, ma'am.
Thank you, Dr. Alka Saxena, ma'am. You have covered the topic very well, and thank you very much for your comprehensive presentation. So, anybody has any questions, please you can ask or just put the question in the chat box. Okay, so I don't think we have any questions, but still, if we have any questions, please put in the chat box meanwhile. And thank you, everyone. Thank you, Dr. Alka Saxena, once again. Over to you, Sheetal.
Thank you so much.
Thank you, ma'am. Sorry for the inconvenience. Like the second session for today's webinar was of Dr. M.S. Vinci ma'am, but due to some reason she can't able to take this session. So we are very sorry for everyone, all the delegates, all the participants. So moving towards the last session of today's webinar, I would like to introduce today's moderator for last webinar, Dr. K. Nalini ma'am. She is the executive member of NSS. Ma'am is working as a principal in Quadra College of Nursing. She is having 17 plus years of experience. Ma'am is also a INC inspector. Ma'am is specialized in medical surgical nursing. She is also having various research publications. Ma'am, we are very glad to have you among us. I hope you the further session will be continued by you, ma'am. Over to you, ma'am. Ma'am, your voice is cracking, ma'am.
You. Mrs. Sheetal, to introduce me for this session. Good afternoon to all. I would like to thank Dr. Namita Christ and Mrs. Sheetal. Privileged to help the Department of Mental Health Nursing at Nimali, Dehradun. With over 20 years of research and academic leadership, Dr. Grace is a distinguished educator, researcher, and mentor. She has authored more than 33 research publications, received numerous prestigious awards, including the Best Teacher Award and Veertha Samman for Mental Health Services, and has made significant contribution to mental health education, research, and community outreach. Today, she will be sharing her expertise on the important topic, role of nurses in early identification, brief intervention, and referral for substance use disorder, and helping student nurses to understand their vital role in promoting mental health and supporting individuals affected by substance use disorder. Please join me in extending a warm welcome to Dr. Grace.
Thank you so much, ma'am, for your kind words regarding my introduction. It's an honor to be speaking at this national webinar. Before I begin my session, I just want to express my sincere gratitude to the organizing committee members of ERICA Chapter 3, Uttarakhand, Nursing Scholar Society, College of Nursing CIMS, and Arogyam College of Nursing for inviting me as a resource person on this significant event. It's truly an honor to be a part of this national webinar on International Day Against Drug Abuse and Illicit Trafficking. We all know that the nurses are the frontline defender in healthcare today. We will explore how to SBRIT approach, empower the identification and address the substance use disorder. So without wasting the time, just I want to share my PPT and want to start the presentation. Will it be visible to all? Is this visible?
No, ma'am. Right now it's not visible.
Now? It is visible because
no, ma'am.
Is it visible?
No, ma'am.
No? I shared it.
Maybe it might be lagging something.
Now?
Due to network issues.
Because here I can see I am sharing screen. Now will it be possible? Will you able to see it now?
Ma'am, at my side I can't able to visible, but I will just cross match with others whether they are visible.
Yeah, kindly ask others also whether they are able to see or not, because I have to again will share it. अभी दिखाई दे रहा है शीतल मैडम?
मैम अभी भी नहीं दिखाई दे रहा है.
मैं दोबारा शेयर करती हूँ. Because here I can see that you are sharing the screen. इधर मुझे दिख रहा है.
Yeah. Should I stop sharing? So it may help you.
Yes. आप शेयर करिए. हाँ. अभी आ रहा है?
हाँ.
अभी दिख रहा है?
Yes, ma'am. No.
हाँ, actually you were sharing the slides, no? That's why only people are not able to see. Now is it okay? May I proceed?
Yes, ma'am. Now it's visible.
Yeah, okay. So, good afternoon or good evening, everyone. The topic we already introduced you, that is the we nurses are the frontline workers while we are going to give the care to the patients. Here, the role, my role is for the nurses is the early identification, brief intervention, and referral for the substance use disorder. That is the SBRIT approach. I'm going to elaborate it. First of all, we should understand it, why it is required, why we have to go ahead for the SBRIT approach. Because while we are going to see it, the globally picture regarding the substance, so we can see here that United Nations Office of Drugs and Crime has given us in 2023, they have given us the data that 292 million people worldwide use drugs. That is in 2021, and the data is published in 2023. Same as WHO in 2022 has given the data that is 1 million deaths annually due to drug use disorder. Same as again United Nations Office of Drugs and Crime has given us the data that 3.2% every year it is increasing drug use among the people aged between 15 to 64 years from last decades, and 500 US dollar, that to billions estimated annually globally economic cost to the substance use. Same as United Nations Office of Drugs and Crime given us the data in 2019. And who all are in the risk, that we can see adolescents and youth, people with having a mental conditions, they are also going to fall down into the substances. Then family history of the substance use, and stressful events, and the person is having easily able to get the accessibility and is easily able to get the substance. The person is also able to get into the, or the person is in the risk of getting the substances. Same as we can see the commonly used substances are globally, that is cannabis, opioids, amphetamines, cocaine, and easily any type of the substances. These are the major substances which are easily available. And mainly nowadays people 219 million people are using that, the data which I have taken, that is in 2021. Same as the numbers you can see. If we will go ahead in the next slide, so we can see that if the person is indulging themselves into the substance use disorder, definitely person lead to many issues related to mental health problems, relationship breakdowns, then poor performance in their studies. If adolescents are going to consume it, or if adults are going to consume it, definitely their professional things also, performance also going down. Same as physical health risk also there. And if you are going to have a overdose, so death also can occur. So we can say to all individuals that addiction is not a choice, but recovery is possible. So early identification, brief intervention, and timely referral, it's really give us the better outcome. If we will go ahead in a similar slide, whatever I have shown the previous one, in that we have seen the health impact of substance use. So we can see like that only, if we are going to use or consume alcohol, tobacco, illicit drugs, and misuse of the prescribed drugs, what ma'am also explained in the last presentation, that morbidity, mortality, and accidents really, or injury really, the person can get it. And if we will see the morbidity, in that illness and disability will be there. The major risk under it will come cardiovascular diseases, liver diseases, respiratory, mental health issues like depression, anxiety, respiratory COPD, infection, asthma. Then fatty livers will be there if we are going to see the disorder or disease because of the substances. There will be fatty liver, hepatitis, cirrhosis. These things will be there. Then if you will see the cardiac issues, so definitely hypertension, stroke, CAD, chronic heart disease, these all things will be there. And we can go ahead if see that cancer, the oral cancer, because if we are going to consume the tobacco, so definitely oral cancer, lung cancer, then liver issues, esophageal issues will be there. Then metabolic disorders also will be there, like diabetes also will be associated with there, and obesity. So that is really lead to reduced quality of life, and disability and poor productivity will be there if we are going to consume the substances. And we will see under the mortality and morbidity. Now if we will go ahead with the mortality, definitely premature deaths will be there. Like WHO in 2023 has given the data that 3 million deaths every year globally due to harmful use of alcohol happening. And then in 2000, same year 2023, United Nations of Office and Drug Crime has given the data that is 6 lakhs deaths annually due to drug use and its complication. Same as WHO again has given what I have told you in the previous slide, that 3.5% of the deaths in 20 to 39 years of the persons are there. So this is really not good thing that we are going ahead in that, and the person is in a depressive phase, so definitely person is consuming it. So our cognitive process also going to decrease if we are going to consume the alcohol, and suicide and overdoses deaths are also reported. So premature deaths and loss of healthy life years are reducing day by day. Same as if we will talk, because I have divided substance use and misuse among under three category: morbidity, mortality, and accidents and injury. So if we will talk about the accidents and injury, 25 to 50% of road traffic deaths are due to alcohol related issues were there, and WHO has reported this. Same as increased risk of unintentional injuries, fall, burns, and drawing are there due to any type of substance consumption, and high involvement in violence, assault, and homicides also are there. So these all are there that we have to be a bit cautious about it and reduce the judgment during consumptions of the any type of substance is there. So it will lead to injury, disability, property loss, and social disruptions are also there. So we can say like that substance use is a major public health concern and contributing significant morbidity, mortality, and accidents. So definitely it will become a burden over the society. If it will become a burden over the society, so we have to be we should think about it. So here I have listed out some burdens and related to the evidence, what all evidences are reported, and the reference also I have given. So aspects are in regard of burdens are: major global public health challenges affect physical, mental, social, and economic well-beings, associate with chronic disease, accident, violence, suicide, and premature morbidities and mortalities, burden on families, healthcare system, and society. Then substantial treatment gap in among the population. So these are the aspect which really becoming burdensome of over the society. So the evidences are there. If we are going to talk about the major global public health challenges. So in 2022, United Nations Office of Drugs and Crime in 2024 reported that the evidence is 2022 and reported in 2000, means published in 2024, that approximately 292 million people worldwide use drugs, representing a 20% increase over the previous decades. So that is also becoming a burdensome. 20% is increasing. Then using these substances, and then affect physical, mental, and social and economical well-being. So WHO in 2024 has reported that substance use disorder are associated with liver disease, what I already told you in the previous slide, cardiovascular diseases, and many diseases are, and less loss of productivities are there. Then this has also become a burden on the society. Then associated chronic disease accidents, what I already discussed you in the previous slide, that is WHO Global Status Report in 2024 has given that the data is that alcohol and drug use contribution to more than 3 million deaths annually, according to 4.7 of global deaths, and linked to the injury, road traffic accident, violence, and suicides are reported. The data has given by the WHO global status under the global status of status report of alcohol and health and treatment of substance use disorder. If we will talk about next one, that is burden on family and healthcare system and society, we can say WHO and UNOCD 2024 both has given this data. The substance use leads to increased health expenditure, caregivers burden. We all are, our master's students used to, our basic students used to do this study. So definitely we can if see, so the WHO also have given the or supported with the data that healthcare, caregivers burden is really there. Social stigma is also there. Family conflicts also there if any single person is consuming substance in the family, and domestic violence and reduced quality of life is also there, and that is also proven, and WHO and UNOCD also supported with the data what they have reported in 2024. Then treatment gap is also there, that reported by in 2019 National Survey of extent and patent of substance use in India. They reported that in India, 14.6 of the people aged 10 to 17 years use alcohol, and 21% use opioids, and only 1 in 38 persons with alcohol dependency received treatment. Only that many people are received the treatment. So there is a treatment gap also. So my topic is really, now you can understand what is my topic. So first I have covered what is substance and how many people globally and in India are indulging in substances, then how they will become a burden on the family members through the evidences, through the reports, and through the global data according to the WHO, and people have done the researches, and National United Nations of Office of Drugs and Crime, I have given the how the people who consuming the drugs, they'll become burdensome on the caregivers, nation, country, and outside worldwide, how they will become a burden on other people. So the globally evidence, so for that is really very important that we can go ahead and think about S-BIRT. S-BIRT is really important. So first I will let you know how international studies are supporting S-BIRT and how national India studies are supporting S-BIRT. Then I will let you know what is S-BIRT and why this S-BIRT support and approach is really important, and what nurses are doing for this. So if we will see, these are some researches. First of all, I have made 4 columns. First is related to the author, then where the study has done, what is the study title, and what key findings received through that study. So many studies are there. So first is Barrett et al. In 2007, then Madras et al. In 2009. These are, first one is Switzerland and second one is in US. And third one, the study has done in the Australia, Brazil, US, and India. The WHO assist study group has done this study. Then in 2017 in US, Glass et al. Has done the study. And same as many are done, but I have taken out few studies where we can see that S-BIRT is really approachable, and it really do a good intervention along with the people who are using unhealthy lifestyle, living in unhealthy lifestyle and consuming substances started. They are in, we can go ahead and give them a primary prevention, and the person who already addicted, so for that is good. Through S-BIRT, we can go ahead and give the secondary prevention. And in secondary prevention, early detection and treatment modalities we can use. And we as a nurse can become a bridge between the person who is consuming the substance or the family members of the substance user and the tertiary care hospital. So we as a nurse, we will become a bridge between the consumption and the tertiary care hospital. So that's why S-BIRT is really important, and we should understand it, what is the approach of S-BIRT. So the findings, so the titles are screening, first of all, screening, brief introduction, and referral to the treatment, S-BIRT towards a public health approach. First title is like that only. Second is also screening, referral, then a randomized control trial and systematic review of S-BIRT, and screening, brief, same as the titles are giving like that only. And the key finding is that reduce the, what finding come up while the people have done the study on the S-BIRT, that worldwide. So that the outcomes are coming like that only, that alcohol use and that reduce of risky alcohol use and promote early help seeking primary care setting behavior of the individual living in the community or in any area, and where they have done the study. Then S-BIRT implementation in the emergency department, primary care and community setting reduce heavy alcohol use and illicit drug use and improve the healthcare outcome. Assist linked brief interventions significantly reduce substance involvement, and same as S-BIRT, what effectively is reducing alcohol misuse. So these are the studies which introduce the S-BIRD is really good in reducing risky behavior related to the substance, and it is very good approach because there is in this intervention is also there and referral is also there. Now in India also many study has done which telling us that it is really good approach and we should go ahead and continue this. So WHO, Ambedkar et al. In AIIMS, Gujarat, Guru Raj et al. And NIMHANS. They have done multiple studies in this area only, and which studies really showing that S-BIRD is really important. So I have taken these study, and these studies are also showing that it is really good approach and we should go ahead with this S-BIRD approach. So this is a gist what I just make a background in regard of that, and it is really important that we have to understand why this approach is really important. Now if I will say this is only a gist what I have given through the research study what have done in the worldwide and in the India. Now I search many things, and I got this also, that S-BIRD is most effective with a patient with unhealthy alcohol or drug use. Means it is not like that the person is having a substance disorder, or a person is just started consuming the substances or having a unhealthy alcohol or drug use. So here this picture is depict that it is more, S-BIRD is more effective when the person is with unhealthy alcohol or drug use and who don't have a substance use disorder or diagnosed as substance use disorder, because it will fall down into the primary prevention. Otherwise we have to send the person to the referral, like in a tertiary care hospital. So this is also one of the things that we have to understand, it early identification is very, very important. So my topic is again is related to the early identification, the nurse's role in the early identification and brief interaction and referral. So in the regard of early identification, this picture I just want to show you all, that if we will go ahead with the early identification, so definitely unhealthy alcohol and drug use we can reduce among the society or among the community. Now the topic is that how that S-BIRD works, how the S-BIRDs work. So we have to see how it is work on the unhealthy behavior, use of drug, or on the person is already diagnosed with substance use disorder. So S-BIRD means, first we are going to, S stand for screening, BI is a stand for the brief intervention, and R is a stand for referral, and T is a stand for treatment. So is an evidence-based patient-centric approach to identify unhealthy substance use early, how early we can identify is, and how early we can send them for the treatment or references. It is very important. So we are going to see how the S-BIRD works. So first of all, we have to see how we are going to do the screening, how we are going to do the brief intervention, and how we are going to refer the person who is consuming the substance, and how we are going to follow up after the referral and treatment. That is very compulsory that we have to do the follow-up care also. So while you are going to do the screening, so we can say the person is having low risk, or if the person is required intervention, means the person is using more substances, which we can say the person is in a risky phase. If the person really required reference and treatment, the person is come into the use of the person become dependent on the substances, and we can say the person fall down into substance use disorder. And if the person is took all the proper treatment and all, then we can say the person is going in a recovery phase. So for that, it is really very important that we have to do the follow-up. So this is the SBIRT work, how we can say the SBIRT is working. Like that only we are going to approach. So while screening, we are going to see the screening. So there are many tools are there. The tool is related to substances are audit, assist, DAST, CAGE, and SDS. These are the tools are there mostly we are using to do the screening, and the goal of during the screening is early identification before problem becomes severe. That should be our goal. And then if we are going to move to the brief intervention, here we are going to motivate the person that person should not consume the substances. Here our goal is that to reduce or stop unhealthy substance use or prevent progression of getting the substances or indulge himself or herself into the substances. That is the brief intervention regarding the substances. So we have to motivate as a nurse, we have to motivate the person should not go ahead to become dependent personality over the substances. But if we will move on to the referral and treatment, so we should understand that the person already started consuming and become dependent over the substance. So for that, we have to send the person to the de-addiction center. That is also, we know that. So our goal should be like that only, that we have to ensure and assess to appropriate treatment and support we can provide to the person. That should be our approach and goal. And while the person already gone through with all the treatment and all, and the person is okay with all that stuff and going back to the community, so we have to, as a nurse, we have to give the follow-up support also. So here the goal will be like that only, we have to promote recovery, prevent relapse, and improve quality of life of a person. That is very important, and we have to understand this. So who will come into, and to whom we can say the person is going to get the benefits in a regard of it? Anyone using alcohol, tobacco, or drugs, or unhealthy behavior, showing or risky way, the person showing or indulging himself or herself to get involved into the substances and fall down according to DSM-5, fall down into the DSM-5 criteria of substance use disorder. The person is really going to get benefit with the SBIRT. So this is how we can say when the community and person and caregivers are feeling so burdensome. So like that only SBIRT work. So my main topic is SBIRT, and now we will move on and we will see how we are going to approach to identify the SBIRT. So for that, I already told you that we have to go ahead for a screening. In screening, we are going to identify the risk factors. Then in brief interview, definitely we are going to ask the changes and motivation, how the person can motivate themselves, and identify the person, how severely the person is getting the substances. Then referral and the treatment and follow-up that we have to ensure. So our purpose is screening. Purpose for the screening is to detect risky substance use and early detection, and overcome the person come into the crisis or problem. Before that, we make the person to overcome with that. Then in brief introduction, to encourage the person to reduce and stop the substance use, and in the identification, to identify the severity and need for further action. That should be our motto through SBIRT approach. And if we are going to see R for referral, so to connect the patient to to get the specialized treatment, what I am telling you since the beginning of my slides, that we'll become bridge between the patient and the tertiary care hospital. And the treatment and follow-up, definitely to ensure community of care and prevent relapse should be our motto. So it will follow like that only. So this is the approach what we have to do under the SBIRT approach. Now, if we are going to see the SBIRT referral pathway. So we should understand it. While we already see the referral means we have sent the person to the community to tertiary care hospital. So my under it, first identification, I have covered the identification. Now intervention, here we have covered the intervention, how we are going to do the intervention, motivation, how we are going to do a motivation, and what techniques we are going to use during the motivation, that we give empathy, self-efficacy, and 5 A's we are going to introduce, like we ask, advise, assist, and arrange the things for the person and their relatives. So this is the framework what we have to do during the intervention. Now if we are going to talk about the referral pathway, so referral pathway is telling us we already encounter the patient, we already screen the patient through the tools. Now if we already assess the risk assessment, when we will see the person is under the risk assessment, then we will divide into under 3 categories. When we are going to divide, the first will be the low risk, moderate risk, and high risk dependency. 3 categories were there. So under the referral pathway, first of all, we have to encounter the patient, then screen through the tools, and then identify the risk assessment. Through risk assessment, we are categorize the person's severity of dependency on the alcohol, on the substances. And after that, definitely we are going to send the person for the referral pathway. If we are going to send the person into the referral pathway, the definitely person is going into the de-addiction center or specialized treatment facilities where psychiatrists are going to approach to the person. Then clinical psychologists and counselors will be there to deal with that, because the person is coming into the or following into the risk assessment, risk that to low, moderate, or a high risk for dependency. Then rehabilitation and community support group should be there. So this is the referral pathway what we have to take in mind, because here nurses' role between the community and the patient is here under the SBIRT pathway is that much only. And after that, when the person goes into the referral pathway to connect to the care center or tertiary care center, there the de-addiction center people will take care of it, or tertiary care people will take care of the person in regard of psychiatrists, clinical psychologists, rehabilitation services, and community support group. So that we have to understand. And after that also, our SBIRT psychiatric nurse role come up in a 5th step, that is a follow-up and community care. There, as a nursing fraternity, we have to follow what role comes up. We have to follow or monitor the treatment adherence of the patient, and coordinate with the coordinate with the treatment team also, and provide ongoing support for to prevent the relapse, and involve family members also for the support system. So we have to understand very specifically what is our role. Our role is, first of all, under the SBIRT, first we have to encounter with the patient. We have to go ahead for the screening also. Then we have to understand the risk assessment, and we have to categorize the patient under 3 categories. And after that, we have to send the person to the tertiary care hospital or de-addiction center. There they will take care of the person who are coming into the risk like low risk, moderate, and high risk. After that, the person is coming out from the rehabilitation center, de-addiction center, or any tertiary hospital. Now again, our role as SBIRT nurse coming up, approach is coming up, that we have to follow up the patient, and we have to give the continuity care to the patient. So that we have to understand what is the referral pathway. That is also one of my topic. Now, if I am going to move to the role of a nurse in SBIRT approach. So again, I have taken out many researches where the nurses has done the on nurses has done the study, and here the WHO and IDA, and again UNOCD and DSM-5 also is telling. These are the things that we have to understand, that role of a nurse, what will be in the SBIRT. What I have already told you, that SBIRT is having these are the roles which I'm going to tell. First is screening and assessment, history taking and observation, identification of risk factors, recognizing early signs, then providing health education, reducing stigma and building trust, documentation and referral. These all are the nurses' role under the SBIRT. When we are going to see these are the studies which done under these nurses' role, that the nurses has to follow these audit tools, these tools to identify or screening the patient, and WHO guidelines for the SBIRT is given in 2010 and SAMSHO also given in 2023. Same as the nurses has to take care of the history and psychiatric history, and nurses has to do the observation. So for that, nurses has to do to assess the substance use history, behavioral changes that we can see in NIDA 2024. They have given very specifically how we can assess and how we can observe and take the history of the patient. These are the evidences. And if we are going to identify the risk factors, so definitely again UNOCD has given in 2024 that we have to recognize risk factors such as adolescence, peer pressure, family history, all that things we have to take. Like that only we can identify these are the nurses' role, these are the activities what nurses has to do, these are the evidences that we have to follow while we are working under the SBIRT. Now, if I'm going to say what role of nurses in early identification, what is my role of nurses in early identification? Here I have given only the evidences and activities and role of a nurse, what a nurse has to do according to the evidences, and evidences also are there. Here really under the screening, under the brief intervention and referral treatment, what nurses should do and what are the nurses' role under the SBIRT approach. So SBIRT is an evidence-based patient-centric approach that I am telling from my first slide, and it is an enable health providing and specialized nurse to identify risk substance use, provide early identification and connect individual to approach treatment and support services. For that, under the screening is identification and risk. Under it, the nurse's role is to conduct routine universal screening. All from the beginning, I am telling screening through these tools, validate tools. We have to do the screening. After that screening, what outcome we are expecting as a nurse? My role is to do the screening, but before screening, my outcome should be set. So my outcomes are before screening and after screening, I should get like that only identification of the individuals at risk or with harmful substance use. Evidence like that is screening in a primary care, increasing identification of risky substance use by 2 to 3 times more. That is given by SAMSHO 2023, that if nurses are going to do the screening, so nurses are going to get a proper and data that the person is really consuming more than it, whatever I have taken early screening. Now they are taking more, consuming more substances, or they are not consuming that much, or they are staying in a same. So outcome should be early set before screening, that what I am going to get through this screening. So that is very important, identifying the risk factor, early warning signs and co-occurring conditions, what will be there. So we as a nurse should be on our toes and be ready for all that stuff. Then second one, in brief intervention, where we are going to give the motivation to our substance consuming persons who is consuming the substance. So nurse's role is providing personalized feedback of a screening to a screening result, whatever screening nurse has done in a first phase, second phase, and during the intervention, we should be true enough in front of, because they are having insight, so we can tell them what the result came. And here we have to use the frames model, where we are giving feedback, responsibility, what should be the responsibility for the person, like you will get the physical issues also, what I shown you in second slide, and what will be your mental disorders, what will be your cognitive process. Like that only we have to make the person should be aware about it and may take their own responsibility. And We should be more empathized for the patient on their relatives, and self-efficacy we have to develop among the patient and their caregivers also. So that is our motivation, or brief intervention should be there along with the patient and their relatives. So our outcome should be like that only. Increase awareness, motivation, and commitment towards the reduction or cessation of the substances should be there. Means awareness should be increased, and we should motivate the person. That person should not consume that much substances, or reduction should be there in consuming the substances. Now, if we are going to talk about the referral to the treatment, so we have to, as a nurses, our role should be like that only. Assess the need for specialized treatment based on severity. We have to assess that the person really required specialized treatment, because we are going to refer. So we have to do first assessment on which basis on what basis we are going to refer the person to the tertiary care hospital. So assessment, we should be thorough enough about the competent enough under the breadth. We should be very confident as breadth under that. We should be very confident on that, and provide clear information about the treatment option available and treatment modality. We should not make the person and their relatives in the dark, and how much they have financially, they will become burdensome also. That also we have to tell very specific. Then we should monitor the adherence, progress, and provide ongoing support to the person and their relatives also. And we have to do the follow-up care also. But our outcome should be in this, should be like that only, that timely access to the access to appropriate treatment should be there while we already assess the person's need, that person really need or required specialized treatment. So we have to be are on toes, and as early as possible we should give that, we should refer the person for the better treatment or recovery. Then that is very important, that we have to understand as a nurse, we should are often the first line of contact with any healthcare system. So as both giving us the opportunity to be more prompt and to be on our toes and understand the patient's condition, and how we can screen, how we can give the brief introduction and intervention, and how we can do the referral and treatment to that particular situation. So our core principles for birth should be like that only, that we nurses should think that we should receive patient with non-judgmental, and we should give non-judgmental care, and we should give patient-centric care, and we should keep the confidentiality. We give respect to the patient and their relative in regard of whatever substances they are consuming. Or we have to be think about the cultural sensitivity also, and we have to provide the empathy also to the patient. And evidence-based practices we have to do, because in each topic what I am taking, before that I am giving the evidences. A nurse's role, I am talking at present or explaining at present. Before that, I have shown my slide. In that evidences I have shown that because of these evidences, we have to go ahead and give the care in as birth approach. So that is very important while we are, because we all are the learned nurses, we all are the graduates, we all are the postgraduate nurses. So evidence-based practice care we have to provide. That is very important. And interpersonal collaboration is really required while we are doing this referral to the treatment, because we need psychologists also. So multidisciplinary or multi-team approach will be there under the SBIRT. So this is the gist of the topic what I have received, that is the role of nurses in early identification, brief introduction, and referral for the substance use disorder and unhealthy behavior of the substances. That is the SBREATH approach. So this is all about my topic. Now I will move to my conclusion. So from the beginning only, I am telling that as birth is an effective evidence-based approach for the early identification and brief intervention and referral of the individual with substance use disorder. In the nursing syllabus, it is like primary, secondary, and tertiary prevention, and it comes into the community psychiatry. So that is only as birth approach, but it is not all about the community. It is, you can get it anywhere else. Like if any individual wants and required screening, brief intervention and referral and treatment. So if we are, this is as birth approach are giving us the space that we can go ahead and early identify the problem, and brief intervention also we can give, referral also we can do it. So it will give a holistic benefit to the person who is consuming the substances and their relatives also. Here the nurse's role is very, very important, and it will strengthen the implications of the SBIRT in the healthcare setting, especially in the primary care centers. And that is very important that we should be more equipped or competent, or we should get the training from the healthcare professionals and become a specialized nurse to work under SBIRT. And we are having good connections also with other healthcare professionals also, and community support also should be there while we are working in the primary healthcare centers. So it is a collaborative approach. So I can say SBIRT approach is really important for the substance use disorder or substance use consumption unhealthy behavior of the patients. So thank you so much for that. Together through SBIRT, we can identify the patients' risk behaviors, and we can intervene it briefly. And if really they are falling down 3 categories of the risk behavior, like mild, moderate, and severe, so definitely we have to appropriately, as early as possible, we have to refer them. And definitely when follow-up required, definitely we have to support them, for the adherence of the treatment and how they can cope up with the in the community. So this is all about my topic. If anybody is having any doubt, kindly ask. Thank you.
Thank you so much, ma'am, for your enlightening presentation. As Nalini ma'am is having some network issues, so she can't able to join us. So I'm continuing her session. Your valuable insight and a deep knowledge which you gave regarding this and the evidence-based practice, how much it is important for the nurse to go with that. Unless and until we are not practicing this evidence-based practice, it is useless. So it was very insightful, ma'am, and it was very knowledge really the responsibility of nurse, the thing which should be more focusable. It was really clear, and thank you so much for ma'am for your presentation. Now we shall have been going with the interactive session. If anyone want to ask any question, the participants are requested to post their questions in the chat box or raise their hands virtually. Is there anyone to ask? Ma'am, I think so all are no questions are there, means all are clear with the topic. Thank you so much, ma'am.
Thank you so much. If any future queries also will be there, so you all are having my number or email ID also. You can post. I am very happy to give response. Or if anyone anytime they want to ask, they can approach you people, and you people can get it touch in with me, and I will definitely ready to give the answer whenever is required.
Thank you so much, ma'am. Thank you, ma'am.
Thank you so
Definitely,
much.
ma'am.
Thank you.
As we approach to the conclusion of today's webinar, I invite Mr. Pradosh Soomvanshi sir, Executive Member of ERICA Chapter 13, working as a professor in Arogyam Nursing College. So we invite you to propose the vote of thanks. Welcome you, sir.
Thank you, Sheetal ma'am. Am I audible to you?
Yes, sir, you are audible.
First of all, giving a vote of thanks, I want to place my sincere Arogyam Pranam to our ma'am Narula Khanna ma'am. Please, ma'am, accept my regards from India, Uttarakhand. Thank you so much, ma'am. So, on behalf of Arogyam Nursing College, Roorkee, and College of Nursing, CIMS, Dehradun, Uttarakhand, it is my privilege to present a vote of thanks on the special occasion of India's today's national webinar organized on the occasion of International Day Against Drug Abuse and Illicit Trafficking. We extend our heartfelt gratitude to our esteemed patron and guiding force, Professor Dr. Suresh Narula Khanna ma'am, seed founder and patron of the Nursing Scholars Society India, for her constant support, foundation, visionary leadership, and unwavering support in promoting nursing education and social awareness. Thank you so much, ma'am. Our sincere thanks to respected Binu Joy sir, National President, Nursing Scholars Society, NSS India, for his encouragement, motivation, and continuous support in making this academic event a grand success. We are deeply honored by the gracious presence of our Chief Guest, Professor Dr. Raman Kalia ma'am, Principal, Saraswati Nursing Institute, Punjab, whose inspiring address enlightened and motivated all participants and all of us. We express our heartfelt appreciation to our esteemed guest of honor, Professor Dr. Saima Jalani ma'am, Assistant Professor, Government Medical College, Anantnag, Jammu and Kashmir. Professor Dr. Mary ma'am, Deputy Director, CMC Vellore. Professor Dr. Mohammad Hussain sir, Chairman, Board of Studies, Maharashtra University in Nasik. Professor Dr. Bhaskaran sir, PhD College of Nursing, Coimbatore. Your valuable insights, wisdom, and encouragement have greatly enriched this academic gathering. Without further ado, I would like to take opportunity to place a special note to our resource persons. Dr. Alka Saxena ma'am, Government College of Nursing, BRD Medical College, Gorakhpur, Uttar Pradesh. Professor Dr. M.S. Vinci ma'am, Principal, Bombay Hospital College of Nursing, Indore. Due to some unavoidable circumstances, ma'am was unable to join, but thank you once again to ma'am. Dr. Grace Meduna Singh ma'am, Head, Department of Mental Health Nursing, Himalayan College of Nursing, Uttarakhand. Your informative presentations, evidence-based knowledge, empowered with us with a deeper understandings of drug abuse prevention, mental health, and a crucial role of nursing professionals in creating a healthier society. We sincerely appreciate the dedicated efforts of ERICA Chapter 13, Uttarakhand Nursing Scholars Society, organizing team members, our most respectful Professor Dr. Namita Krishna ma'am, President, ERICA Chapter 13, Uttarakhand, Professor Dr. Anjana William ma'am, Vice President, ERICA Chapter 13, Uttarakhand, and Principal, Himalayan College of Nursing. Professor Mrs. Chetna ma'am, Secretary, ERICA Chapter 13, Uttarakhand, and Principal, CIM College of Nursing. Our sincere thanks to all those who have joined us through different places of country from India and other states of India, technical support team, and every individual who worked tirelessly and behind the success and to make this scene success and event memorable. Let us continue work together to spread awareness regarding mental health issues, social responsibilities, and collective collaboration and collectiveness towards building a drug-free society. Thank you once again.
Let me add a little bit.
Over to you, Sheetal ma'am.
To MC, thank you a lot, and to our Pradosh ji, who have just given us vote of thanks.
Thank you, ma'am.
And especially
Thank you,
once
ma'am.
again to Namnita madam. Really a pillar of your chapter, but she is my right hand for 3 chapters. She has established and worked very hard, and it takes extra mile to do voluntary job, but you people have done excellent job. Grace madam presented thoroughly, and Alka ji It was good to hear. Only Mary, she is in a CMC, you know it, mission hospitals and colleges are. She was in the meeting. She kept on saying, I come and join it. I can wave hand, but I cannot talk because I'm in the meeting. So just excuse her. But she is very active in our chapter, in our national. She is our chief editor for the journal we are going to establish. Thank you to all of you. On to Sheetal.
Thank you so much, ma'am. Thank you so much. We were inviting you because you were sitting for such a long duration. We were thinking like we will see you only in the video, but your physical presence.
Don't
we
worry, I
literally
had my tea, and I had my walk a little bit. So I'm okay, not to worry. Worry
Thank
about
you so
yourself now. You will be working or you will be doing whatever. Good luck to you all.
Thank you, ma'am. Thank you to our respected dignitaries, resource persons, faculty members, all the principals from different colleges, those who have joined us today, and also to the all the participants from different parts of India. I really greet everyone and thank you everyone for joining this session. Let us remember every step today. Today's awareness is a step towards the healthier and safer society. Today, let us preach to say no to the drugs and say yes to the life. So, have a great day. Thank you and Jai Hind. Thank you so much, everyone. Once again, thank you.
Thank you, ma'am. Thank you.
Once more, I have to say something for my founding president, Binu sir. If he wouldn't have said yes, we wouldn't have been sitting here. So also today for Zoom, he has provided for 2 hours plus, whether he is in the church, whether he is sitting in the parking lot. But once we have decided we will have webinar or anything, he will be there. So Binu sir, thank you so much.
Thank you,
Ma'am,
Binu sir.
for one photo. Hello, ma'am.
I request everyone to open their camera so we can have one
Yes.
small photo session.
For the memories,
Please,
ma'am, Erika chapter
Sheetal ma'am,
memories.
please put first slide of today's webinar. Sheetal ma'am, can you please first
Yes,
slide
sir.
of today's webinar?
I request to all of one, kindly
Yes. Second,
open your
okay.
videos, please.
I request everyone to open the camera so we can go with the small photo session. So it will be memory for all of us, especially for Erika chapter 30. It is our second national webinar. I think so. I have to stop the slide sharing.
Listen, you yourself smile. Yay.
Thank you, everyone. Have a great day. Thank you. Thank you, ma'am.
Thank you, ma'am.